Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 12 minutes before 11 o'clock. It's raining out there, Robin.
Yeah.
We live in an interesting little community. We have a university where nobody has any wrinkles. And the rest of us will have lots of wrinkles.
Yeah.
If you're in the wrinkle category, then you might want to pay attention. You've heard of Botox, right?
Oh, yeah.
We remember when it first came out, we were a little bit concerned because this last three letters of the word is an abbreviation for toxic, right?
Yes.
So
sure.
There's a poison you're putting in your skin to fix out those wrinkles, right? Mm-hmm. Dr. Jerome Potozkin has been with us before. He's a board-certified dermatologist. He's specially trained in the art and science of dermatological surgery. He's a clinical instructor at the University of California, San Francisco Medical Center, and he trains physicians in advanced laser techniques. His book is called Botox and Beyond. If you're looking at the video podcast, it's on the screen right now. Your guide to safe, non-surgical cosmetic procedures. Dr. Jerome Potozkin. Good morning, doctor.
Good morning. Thank you so much for inviting me to be on your show this morning.
You're welcome. Are you in San Francisco?
I am just east of San Francisco in the town called Danville, California.
So do we have anything, because Botox became a household word, everybody knows about it, but we may not know what it is or what to expect from it. Do we sometimes have expectations that are a little bit unreasonable, thinking they're going to be a miracle in some way?
Well, I mean, Botox is purified botulinum toxins, purified protein, and basically what it does is it relaxes muscles. In order for a muscle to contract, it needs to receive a signal from a nerve, and Botox is like the mute button on your phone between that nerve telling the muscle to contract and the muscle, and this causes muscles to relax, and this is effective on what we call dynamic wrinkles. So there are two different kinds of wrinkles. There are wrinkles that are just caused by chronic sun damage, and then there are wrinkles like the frown lines or the 11s that are caused by the constant pull and folding of the muscles.
Oh, okay. And do you recommend Botox for both of those type?
Well, it only works on dynamic wrinkles. It only works on the wrinkles that are caused by the pull of the muscles. So, for instance, your forehead lines, the frown lines, your crow's feet. It doesn't work so well on like wrinkles on your cheek or around your mouth. Mostly for the upper faces where we use it.
We had heard that women would start out with Botox treatments, especially in the lips, but now men are getting into this routine. What do they have to fix?
So Botox, we really don't use that much in the lips. We use injectable fillers in the lips more so. Uh-huh. But men are really jumping into this right now because of, I think, a number of factors. I think that stress and competition in the job market, particularly out in my neck of the woods in Silicon Valley in the tech industry. I think that people are a lot more concerned with how they look because of all the pictures they're posting on social media as well. So men are starting to feel the pressure just as women always have. And I would say the most common things for men would be, Botox for sure, fillers not quite so much as Botox. And then a lot of the newer hair loss treatments are being, really aimed towards men.
Oh, really? And is Botox part of that?
Botox is not part of that, but there are always, new treatments that we're looking at, always new things coming out. And, with men, as we get older, we have less hair where we want it, and we have more hair where we don't want it. And
it's funny because I don't even have the camera turned on, Robin. He can tell that about me.
I know.
So let me ask you something. So that's what the Beyond means in the title.
Correct.
Okay.
Yeah. So we talk about in the book Botox, fillers. We talk about laser and light-based devices for skin rejuvenation. We talk about what's called vaginal rejuvenation. It's got a lot of information.
Wait a minute. Now what?
Well, vaginal rejuvenation, that is not for men. Okay, that is.
Yeah, wait a minute. It might be.
Yeah, depending on your perspective.
I'm teasing.
Well, it might be in today's day in the whole, gender fluid world that we live in right now. So you're absolutely right.
I'm teasing. I'm just having fun. But let me ask you something. Seriously, I want to ask about the book. Does the book help somebody who's, feeling like they could maybe have something done and they would feel better about themselves? Would the book kind of rest them at ease for what they were expecting?
I think the book really is like explaining things for the everyday person who does not have a medical background, so they can understand, like just like we were just talking about, like what does Botox do? How does it work? What's the history of it? Who should I go to have these treatments? Should I have it done in a hotel room where some lady's flying in from Guadalajara?
We had a Florida story like that. That's not good.
Yeah, that happens a lot in Florida.
Wow.
Miami particularly.
Larry had a news story this morning. This woman in Texas is undergoing an 8-hour surgical treatment and then a little bit of non-surgical things to look just like Meghan Markle. Now, is that really healthy for her system?
I think that is in the arena, and this is my opinion, of a little bit on the crazy side and a little bit on the irresponsible side of a physician engaging in that. I mean, that's really what kind of led Michael Jackson, down that kind of crazy pathway. And physicians, I think, primum non nocere is a pledge that we take, which is first do no harm. And I think that when you're doing these extreme things, you're really putting people at danger, both physically and mentally.
Gosh, I love this.
So do you sometimes work with people who've had surgery, like a surgical procedure on their face? Maybe they had a cancerous area removed, and you can maybe help smooth that out, that kind of thing?
We do. So we do, in addition to the cosmetic stuff, we do a lot of skin cancer surgery and reconstruction. And there are different lasers and light-based devices that we can use to make scars look less noticeable and less visible.
Well, that's a good thing. And will the book cover those areas?
The book does not really cover that to that extent. It's more on the cosmetic side of things. And, the book just came out in December, but I'm already thinking about the next edition because there are always new things coming out.
Right.
And do you have to go in, does the person that has fillers and things, does that person have to go in for maintenance, or is this a permanent thing where once it's done, it's done?
There is no permanence in life, and particularly in the aesthetic arena. So it is something you need to think of in terms of a maintenance. So, for instance, for Botox, I will see most patients 2 to 3 times a year to maintain their result. And for filler, depending upon the filler, some fillers last up to 2 years, some fillers last up to 6 months.
And does that affect the nerves at all in the body, the fillers?
It does not. No, it's not affecting nerves at all. It doesn't affect sensation. It doesn't affect the motor nerves. Of course, as I mentioned before, Botox, the way it works is it kind of prevents the communication between that nerve and the muscle, so the muscle does not get the signal to contract. But that's temporary.
In the sample that is provided on Amazon, there was a woman who came to you named Jill in her mid-40s, and she had some. It looked like she was mad all the time. She was frowning all the time, and so that sounds like maybe the ideal candidate to be a patient or in some way that can benefit from what you offer, right?
Well, I mean, for Botox, the textbook example would be someone like that who has what we call glabella frown lines, or what we call the 11s, in between the brow, that makes people look angry and unapproachable. And we notice several things when we treat those areas. Number one, people feel better, they look better. If they're in sales, oftentimes their sales numbers will go up. And newer studies come out that show that it helps with depression.
Oh, really?
That area.
Yeah, I used to sketch at the Hilton, and if somebody had like lines, like I would always know, just don't exaggerate that. Not that I didn't do what do you call caricatures. I just really sketched people like a preliminary sketch, as if I was going to do a portrait. And
right.
And they would always say, "Oh, you can take that off of there." So as long as the picture looked good, so you can take it off for real. I was just not.
We can take it off.
Drawing it in.
I mean, between Botox and Photoshop, we have a great world we live in.
That's funny. All right, let's make sure people can get the book. I found it on Amazon. Do you have a different address you'd like to give us?
No, Amazon is where we get everything, Amazon.com. The book is called Botox and Beyond, Your Guide to Safe Non-Surgical Cosmetic Procedures. We also have a website about the book, which is drjeromepotozkin.com, and people can come visit us and get in touch with us.
And looks like you're getting good reviews, 5 stars. Thank you, Doctor. Thank you for being on the air with us today.
Thank you so much, and have a great day.
You're welcome. You too. We'll be right back.
Bye-bye.
Hey, I didn't know it rained last night.
Oh, it didn't. Why do you say that?